You live in rural Missouri, you may soon have an easier time accessing health care without the long drive to the doctor.
Earlier this month, the governor signed legislation into law that allows telehealth services using audio-only technology. New this morning, WGEM's Cindy Lyerly joins us to explain some possible telehealth changes coming soon. Cindy, good morning.
Natalie, good morning. If you live in a rural area, you can access a doctor from anywhere through telehealth. One Hannibal Regional Medical Center psychiatrist tells me telehealth has grown in use since 2020 and has become a valuable resource for those living in rural areas. He says they are still working to improve it and have a few things they are trying to implement.
I believe we're actually in the process of getting some technology to our rural offices so that we can do telehealth from like office to office as well as office to home. The office to office would be for individuals that maybe aren't as technologically capable or don't have internet connection or things like that.
Telehealth is slightly different than seeing your doctor in person, but he says they can still give diagnosis. They just aren't allowed to prescribe controlled medications without seeing you in person at least once a year. He adds the vast majority of insurances cover telehealth the same way they cover in-person appointments. Kyle, back to you.
All right, Cindy, thank you. With the busy schedules, the Tookstrope says that telehealth also makes it easier for patients to make appointments with their doctors. This legislation does take effect on August 28th.